Look at your news. I'm Brian Sommerfield.
You are the only folks keeping the barbarians in the gate.
I got into the labor movement not because I wanted to negotiate wages. I got into the labor movement because I saw it as a vehicle to do massive social change to improve the lots of people.
Let's take these son of a out and give America back to America where we belong. Thank you very much. Thank you.
As far as I'm concerned, the Tea Party can go straight to hell. I am a real American. Fight for the rights of every man. I am a real American. Fight for what's right. Fight for your life.
Hey, welcome back to the program here on this Monday morning, in hour number 2. I'm Brian Sommerfield, along with Trucker Randy. We are your defending fathers. We've got Izzy McGuire in studio from Watchdog. She's going to be doing a story on this segment as well. We've got Representative Frank Foster on the line, along with Representative Mike Shirkey. And gentlemen, it is a pleasure to have you on this morning.
Well, thank you, Brian. Thanks for having us. And I want to personally thank Chairman Shirkey. It was been a long couple weeks for him through this bill process, and I know this doesn't quite hit the Jackson area, his home territory, this radio station, but I asked him to be on. He has quarterbacked a number of issues in the legislature, this Medicaid reform being one of them, and his time is needed all over the state. It's a big state, and so I'm happy to have him on with me today to go over some of the finer points of what I think is going to be a pretty comprehensive plan for Michigan, and as far as other states go, it's going to be important to reform the welfare system we have.
Good morning, Brian, and good morning, Randy.
Good morning. Thanks for being on with us today. Randy, I've got your mic set okay, don't I?
I can't hear Randy.
And I can't either.
Randy must be taking another phone call right now. He sometimes gets...
I'm back.
Oh, you're back? Okay.
Yeah, Mike, can you hear me okay?
Yes, sir, I can hear you fine now.
Appreciate you, like Frank said, joining us. We are going to record this podcast and turn it into a YouTube video so we can share it with everybody in your area as well and across the state. One of the things I want to tell you is Brian and I have read H3, the substitute bill that was actually voted on and passed. And after reading the bill and hearing from a lot of our audience and Tea Party friends that have asked us to ask you guys questions, one of the first things that right out of the box is like the reoccurring biggest question that we've been hit with. Specifically talks about page 11, line 4. After someone's been on medical assistance coverage for 48 consecutive months, they're able to then do one of the following. Either A, purchase private insurance coverage through an exchange operated in this state, and be considered eligible for federal subsidies by the federal government. So the question is, does this bill, as you guys was initially introduced on May 9th, and then substitute bills were amended there in your committee, does this in fact set up a health care exchange to start the implementation of Obamacare here in Michigan?
Well, let me take that one, Frank.
Okay.
The answer to that is an uncategorized no, Randy. I can see how somebody could read that language and make that assumption, but that's precisely why we added the enactment language at the back, to make sure that there's nothing about this bill that does either does authorize or establish a state exchange. It's basically assuming that the federal governments have an exchange set up. And I would even stipulate to you that that could be that language on page 11 on lines 4, 5, and 6 could be strengthened to make sure that it only refers to an exchange as set up by the federal government.
Well, my question then, because I was going to go to that, in fact, what you referred to on page 25, line 20, where the language is pretty clear that it doesn't set up an exchange, but yet there was something that went on during the vote. State Representative Greg McMaster got up and added an amendment that basically was shot down on a gavel vote that I thought was redundant of that language on page 25, but he took out the word enacting in section 1. And I just wanted clarification. Why was his amendment struck down when it looks like to me it was basically the same language you already have in the bill?
I think that's the reason. It was basically a redundancy to what was already in the bill, and so there wasn't somebody decided that there wasn't a need to do both.
Okay, Frank, you were going to add something to that?
Yeah, no, basically that's the same. Greg was not with us in committee, ended up voting for the bill on the floor, but was not with us in committee. And I've never worked on a bill that has taken this long through the process, or read a bill as many times as I have this bill. But we went over that extensively during the committee process, and I even felt it was redundant. It's a great talking point. I agree, and I'll be coming with another resolution this week absolving us from Obamacare and pushing nullification. But again, it was redundant in the bill. We didn't feel that we needed it. But again, there's no one on the Republican side in the House, and I imagine the Senate, that endorses Obamacare and doesn't think that it should be repealed as the law of the land. And as we work through the next 20 minutes, there's a bunch of safeguards here. I think that if the system goes down, which I think Mike and I both hope the system does go down, that this bill will be irrelevant and will no longer take effect, the reforms that we had in place.
Okay, last Tea Party question that we've gotten over and over again was it talks about the fact that this bill, and you do cite it in the bill, I believe I counted 3 or 4 times, that there's certain waivers that are going to be needed to be gotten from HHS in Washington in order for this bill to stay implemented the way you're passing it. Why then, if it's not, like you're saying, implementing Obamacare here in Michigan, why is it necessary then for all these waivers to be gotten from Obama and Sebelius?
Well, the Medicaid system set up, it's a partnership between, and always has been, between the federal government and the states. And the requirements, the minimum requirements for the Medicaid systems historically have been established and referenced back to the many of the elements of the Social Security Act. And so some of the reforms that we're asking for instance, required contributions, required co-pays, and so forth, those are exceptions that are not allowed in the current Social Security Act, and we have to get waivers to actually enact them. And that's the reason, Randy, why we have to do that.
And if I can just add on that, there's sort of, and this is one of the things that, everyone had a great Father's Day, I hope, yesterday, but I had to convince my old man that this was the right thing for Michigan, too, and I didn't have him, so I know if I can convince him, I can convince Ryan and Randy and Brian today. But the underlying theme in this bill is that if there are no savings realized, then the system reverts. Also, 51 different taxes have been enacted in Michigan. Over $1 billion is being paid out. These waivers are to ensure that we're getting some of that federal money back of the money that we're already paying, and that we discontinue to be a donor state.
And you're talking about some of those taxes would be the tanning tax, some of the other taxes that have to do with medical equipment, taxes like that.
Medical device tax.
The factors leading into Obamacare.
Correct.
Okay.
Say it again, Brian.
Well, there were taxes that were put in place that were the federal government were collecting taxes for 5 years before the Obamacare would be implemented, because the only way they could pass the CBO was to show that it was revenue neutral, because it took in this much in taxes over 10 years, it spent this much in services over 5.
Right.
So
there's a complete disingenuousness to how that was set up, and I totally agree with you. What Frank is referring to is that today, actual taxes being extracted from Michigan businesses and Michigan citizens, Michigan taxpayers, going to the federal government because of new taxes related to the Affordable Care Act, range between, and this is a large range because I get different inputs depending on who I ask, between $600 million and $1 billion that is actually leaving the state today, regardless of whether we decide to reform and expand health care coverage in Michigan or to do nothing. Those taxes are going to be collected, and they're going to leave the state.
And and let me add to that. I don't know how close we are to the break, guys, but there continues to be legislative oversight all in this bill. I'm up in Petoskey, so I don't have the H3 in front of me. I'm working off an old version. I had at home, but some of this language is still similar. And on page 4, 5, 7, and 16, there are references to legislative oversight. So, and we want to review that as far as the waivers go, but also as far as the cost savings go. And we don't trust the federal government, but we also want to be a watchdog over our own Department of Community Health too. So there is oversight referenced throughout this bill, and I think that the legislature is going to be an important part of the process because a lot of these reforms, the HSAs, the co-pays on the welfare system, are relatively new concepts nationwide, and we want to make sure that we've enacted them the way that they should be enacted.
Good time for a break right now. Stick around, more to come. Representative Frank Foster, Representative Mike Shirkey. They'll be back after the break. We're your defending fathers.
Bryant Sommerfield live.
Hey, welcome back to the program here on this Monday morning. 22 minutes after the hour, I'm Brian Sommerfield with Trucker Randy. We are your defending fathers. Joined in this half hour by Representative Mike Shirkey and Representative Frank Foster, talking about the bill that was passed, 4714, HB 4714, on Friday. A lot of discussion over the weekend on it. We have both of them on today to try to help us through the final language that was passed on this bill.
Hey, Mike,
yes,
this is Randy. Just one question that kept going through my mind as I was watching the House camera live on Thursday night there before you guys voted on this bill. And when I saw Democrat State Representatives Santana, Clementi, Townsend from Royal Oak, getting up and singing your praises, and the Republicans that voted no against this bill, I'm sitting in my mind going, okay, is Mike Shirkey such a genius of a chairman and Frank a member of this committee that you guys did these reforms and these substitute bills that you completely buffaloed the Democrats into supporting these things, and the Republicans that voted no don't understand what you guys actually did because they weren't in that committee process? I mean, what's the bottom line here as to why three Democrats that are totally against everything you and I believe in, why were they singing your praises? I just don't know what this bill did, how you were able to pull this off.
Mike, go ahead and answer that first, and I want to respond after, too.
Yeah. Well, Randy, first of all, there's no magic here, no magician, but I got to roll the clock back to when this process started because, as you know, I've said it repeatedly and I've said it publicly that, I started off as a hard no on this. But it was all based on philosophical reasons, very sound philosophical reasons. But when the project and when the bill was sent to our committee, the Michigan Competitiveness Committee, I had a decision to make. I could either maintain my solid position philosophically and basically, just become a blocker and stop the process. Or I could ask myself the question, is there a pathway to yes that would be worth expanding and reforming Medicaid? And I chose, as a chair of a committee, that the most responsible thing to do would be to be open to that question and begin the exploration. There were a number of aha moments as we had weeks of testimony that caused me to go home at night and say to my wife, oh, crap, I learned something new today that is testing my philosophical opposition. Oh, crap, I learned something new today. But the biggest one, Randy, and this is the one where, we may just decide to agree to disagree. The law of the land requires everybody in America today to basically to get insurance. Now, I'm going to focus exclusively on this population from 100% of the poverty level and above, 100 to 133%. These are, by definition, people who are working, many of which who don't have access to health care because their employers don't provide it, et cetera. But because of the law of the land, they have to get it. And so if we imagine for a moment this entire population, because of the law, deciding that they're going to all go en masse to get insurance through a federally provided exchange in Michigan, because we're not going to have a state-based exchange, and then qualify for premium assistance, what is the cost to taxpayers for that to occur? And then compare that, if that same population were to become eligible for Medicaid. And the irony here, the ultimate in irony, is if that entire population got their insurance via the exchange, via an exchange, a federal exchange, the cost to taxpayers is almost double what it would be if they got their coverage through Medicaid. And then the additional irony is, and this is addressed in the bill, is that Michigan's Medicaid system, because it's been set up on contracted health plans and capitated rates for almost 15 years now, is one of the most efficient in the nation. I'm not saying good, I'm not saying perfect, and I'm not saying that there are ways to improve it, but the cost controls in the system have been set up such that the range of benefits offered to the typical Medicaid recipient in Michigan exceeds the range of benefits typically offered to an average small business employee where their employer offers insurance. So we have a significantly higher cost to taxpayers if they get their insurance via an exchange, and a less rich policy. And those were the two aha moments for me that thought, oh crap, how are we going to deal with this? And that was when I began to look in earnest for a solution that we'd be able to capture serious reforms, things that people have been asking for decades, while mitigating the cost to taxpayers globally, or in other words, United States taxpayers.
If I can just expand on that, I was a solid no, probably through 2/3 of the committee process hearing. But really, what ended up, knowing that the Affordable Health Care Act is coming, there's two reasons. We have the federal government in a position where they have to work with us, and so we're able to get some of those reforms, the physical testing, the incentives for Medicaid patient, the health savings accounts people taking ownership over. So all that is great, and I don't think there'd be another time more advantageous than now to get those reforms and those waivers from the federal government. But really, for me, guys, it came down to page 6 and page 7. I'm sorry I'm looking at the H1, but it's still the same language. On page 6, on the bottom, it says, the program described in this section is created to extend health care coverage to the state's low-income citizens and to provide health insurance cost relief to individuals and to the business community by reducing the cost shift of uncompensated care. Before I go to page 7, I want everyone to know the Michigan Chamber, the Small Business Association of Michigan, the business community supports this because it's going to save taxpayers' dollars and it's going to save on insurance rates. And let me go to page 7 now, where it talks about insurance rates. Line 15, the Department of Insurance and Financial Services shall examine the financial reports of health insurers and evaluate the impact that provides medical coverage to the expanded population of enrollees described in this subsection has had on rates. The Department of Insurance and Financial Services shall consider the evaluation described in this subsection in the annual approval of rates by December 31st, 2014. The Department of Insurance and Financial Services shall make an initial baseline report to the legislature regarding rates. After that, she'll make a report regarding the evidence in reduction of rates. We're going to save over $200 million, our department thinks, in general fund savings over the first year with paying down on the uncompensated care portion that all hospitals, even this one I'm looking at in Petoskey, Northern Michigan Hospital. And so at the end of the day, we're able to make a bad system and a bad federal law a little bit better with state oversight, but we're also able to reduce these rates for small business. And coming from the small business world, we couldn't afford health care anymore for 30 employees when I was growing up. And so now we don't have any employees. This is going to help business.
Frank, good place to stop right there. We've got about 15 seconds before we hit the top of the hour. I've got a ton more questions. I'm afraid we're not going to be able to get to those. We'll get to as many as we can after the break. Thanks, Representative Shirkey, Representative Foster, for joining us this half hour. Really enjoyed the conversation. Stick around, more to come. We are your Defending Fathers.